Welcome back to 2 News at 5 o'clock. For some babies, breast milk and even formula can cause a negative reaction in the body. In tonight's Baby Your Baby report, Christina Flores explains what a food protein intolerance is and what parents can do about it.
Yeah, so Hiram was premature. He was born at 29 weeks, 1 pound 15 ounces at birth.
For baby Hiram, being small was normal. He was low on the growth chart, but was following his own curve. Then, at around 3 months old, he became fussy, and his growth plateaued.
If the child is not gaining weight appropriately or growing appropriately, that's going to be a concern.
His reaction was due to a food protein intolerance.
Where a baby who is on a full diet may have kind of mucousy, slimy stools or bright red blood flecks in the stool.
This might mean a child is not absorbing nutrients and developing as they should. The most common foods that contribute to food protein intolerance are dairy and soy.
Those will account for about 70% of food protein induced reactions in an infant.
This is why one of the first things a breastfeeding mom can do is try a dairy-free diet herself.
You need to stay on it for at least a few weeks before you can maybe notice a big difference.
Talked to our pediatrician about it, and I went on an elimination diet because he was breastfeeding, and so I had cut out just all of the common allergens.
For baby Hiram, an elimination diet did not help him grow, so they transitioned to a specialized hypoallergenic formula. And although progress has been slow, it appears to be working.
He's 98% of his ideal body weight, which is great because when we first came to Dr. Sutton, he said he was severely malnourished and he was thinking about admitting to the hospital.
Christina Flores, 2 News.
Dr. Sutton says if you're not sure if your child's diapers are normal, a picture is worth 1,000 words. Grab your cell phone, take a photo, and bring it into the doctor. That way they can make sure that your child isn't suffering from food protein intolerance.